Thank you so much for joining us today. We'll be starting the class right away. Since it's recorded, as many as would join later will find the recording useful, and then they would be able to actually watch on our YouTube channel as well. I want to appreciate you, Dr. Idris, for joining early today. Thank you so much for always keeping to time. So this is the International Institute of Healthcare Leadership and Quality Assurance. I want to give us a brief overview of what the Institute does and what we stand for. So this would help guide the journey, and then I'll move over to the topic, healthcare transformational leadership, which is the topic for today. I want everything to be capped. We set the meeting standardly to be 90 minutes, but basically we want it to be like an hour webinar session where we have the lectures and then we have questions at the end. So please, I would indulge you. If you have questions, you can put them in the chat during the course of the presentation. Either question about the institute or question about the topic for today. That's healthcare transformational leadership. You can actually put those questions in the chat as we go, so that once I'm done, we'll be able to address them effectively. So I want to thank as many of you that are joining. We can reach out to friends and colleagues to also join. And please, I would appreciate in the chat if you can put where you're joining from. Okay, I am so I'm joining from this place. So it would be great to see where you're actually joining from. Thank you so much. So like I said, International Institute of Healthcare Leadership and Quality Assurance. We understand the trend in the quality improvement world, and we know that the world is tilting more towards quality improvement as against assurance, because improvement gives that mindset of actually pursuing improvement, not avoiding the blame game, embracing the just culture. And so that's critical for us to understand. So basically, the Institute is focused on transformational leadership, patient safety and healthcare quality, and then digital transformation in healthcare. These three are rooted in the objectives outlined by the WHO, our Global Patient Safety Action Plan. And the goal or the principles that bind us is championing transformational leadership models to advance healthcare quality and patient safety, embracing healthcare digital transformation to implement scalable and cost-efficient interventions. We're also given to developing organizational strategies focused on value-based healthcare systems. And you know, that's actually the core that drives the world today, because we have a balance of cost, which is affordability of healthcare, and then the qualitative nature of the healthcare system. And then ultimately, we want to ensure that our care system is focused on patient safety sciences and practices, which is very sensitive to risk management, safety assessment, and establishing learning organizations to promote patient safety across board. So thank you everyone for joining. I'm going over the concept of the Institute. And thank you, Dr. Kubita Idris Ambalula from Juba, South Sudan. Others, if you joined late, I asked that we can actually put where we're joining from, maybe the city and the state where you're joining, the city, state, and maybe the country where you're joining from. Just tell us who you are, where you're joining from, so that we just have an idea about you. So I'm talking about the Institute, the International Institute of Healthcare Leadership and Quality Assurance, and I'm talking about our principles currently. Moving over, the Institute has a program framework that is actually focused on outcome-based learning, employing a project-based and continuous assessment as learning. Now, notice it is assessment as learning, not assessment of learning, not assessment for learning, but assessment as learning. As you're learning, you're actually assessing yourself, and then you're becoming better for it. So it's a learning that emphasizes on choice, on ownership, on the voice of the learner, to ensure that all these are applicable in their authentic life scenarios. So we want you to be able to garner knowledge from this platform and be able to apply it practically in your own world, in your own field, in your own environment. And this program is open to doctors, dentists, nurses, midwives, pharmacists, pharmacy technicians, both the practicing professional and their student wing. So this platform is open to learning and is willing to also integrate every every bit of healthcare divide, as it may, healthcare workers. So medical lab scientists, optometrists, physiotherapists, radiographers, healthcare administrators, healthcare IT project manager, and other project manager, as it relates to healthcare. So it's a program that is given to all across the healthcare spectrum. Our goal, in terms of vision, is to establish ourselves as the global leader in healthcare and quality improvement, to rank among top 10 professional institutes worldwide, transforming the African healthcare market. And to do this, we hope that by the year 2050, we're able to catalyze healthcare reforms that will drive development in Africa. We're also planning to train over 100,000 healthcare professionals across the globe by 2030, and 10,000 more yearly subsequently. And then facilitation of learning and assessment tools in all tertiary, secondary, and primary care settings and institutions across Africa. Then in terms of publication, if you're joining or going with us, you would have a platform that facilitates research, because our goal is to drive project-based learning. And so this would open us more to research publication, and currently being built is the website that drives the research publication arm. So we currently have a website now, which, if you have not registered, I'd like you to go on the website and please ensure you register. If you're having any challenges with registration, just go on the WhatsApp group, and then you will see Mr. Richard is the one that's been posting reminders about the website. Just chat him up personally, privately, and then have a discussion on how you will get yourself registered on the website. It would give you a guide to achieve that. It would help you to achieve that. So please, let's ensure we make that happen. Okay, so going along, talking about the Institute, our goal is to transform healthcare leaders, professionals, and students. The reason why we are even more burdened by the pursuit to transform students is because in 2, 3, 4, 5 years time, these students become practicing professionals. If we catch them while in training, they tend to listen more. They tend to align more. They are still in the phase where you can shape their thinking better than for practicing professionals, where we can say maybe there's some calcification in the way they've been trained, and it will take a lot to be able to re-engineer their mind towards the ideal of transformation. So our goal is to facilitate transformative project-based learning experiences that will be driven by outcome, that is outcome oriented. So whatever learning you will be doing with us on this platform, we want it to be such that it's what you're doing on your job, that you're applying it to daily. So let me give an example. When we say, okay, come up with an SOP, I expect you to pick a scenario in your hospital and develop an SOP for it. And when you develop the SOP, you have a meeting with all stakeholders that are involved, you get it ratified, you have a date where it gets adopted or adapted, as the case may be, and then when you get it adapted, then you get it signed by the leadership, and that's what you post back to us as a learning scenario. So that is practical. That shows what you went through. So that brings some level of understanding, as just me telling you, can you write an SOP on how to manage malaria? You could easily just go online and get that done for me. But if you can go through that process of doing it, then it becomes yours. It becomes who you are. Now, the second point is to leverage digital advancement to create flexible learning environment, allowing learners to choose their content and the pace to which they want to use the knowledge you gain to solve challenges in your real-world scenario. Like you notice, the emphasis for Africa is to solve problems. So our emphasis is not just the learning that you learn the theory. Our focus at the International Institute of Healthcare Leadership and Quality Improvement, permit me, I can call it quality improvement or assurance. Let me use the word interchangeably. Our goal is to ensure that whatever learning you're taking is actually used to solve problems on a daily basis in your real world scenario. So I want you in the lab, you're the lab manager, and you're having a challenge, then think about a digital solution that can solve that problem. And then implement the process. In the process of implementation, document every learning curve, and that is how you will be awarded points on this platform. Then the third thing is to build a community of healthcare leaders with a transformative ideals and with strong discipline, which is aimed at revolutionizing Africa's health landscape. That is our goal. And for as many as are joining us, this is what we want you to flow along with us, to believe in, that we can actually fundamentally relearn, rethink, and rebuild the African healthcare market such that it will be able to serve the African populace, and it will bring excellent care to everyone. I appreciate you that are putting in your name. I can see Dr. Salaja Veronica from FMC Owo, Nigeria. Chigo Sakwe from Abuja. Thank you so much. Dr. Ashi from Somalia. Thank you so much for putting in details. If you just join, please just put in your name and the country or the city, the country where you're joining from. I just want to know, I'm currently going through the overview of the institute before I go into today's class topic, which is healthcare transformational leadership. I've been having questions from individuals asking. I just want to have an understanding of the fellowship. As I'm wrapping up, I would also give you the website where you can visit. I want you to peruse the site, and I also want you to register. Ultimately, if you're having challenges registering, just come online, come on the WhatsApp group, and then just drop a message. Someone would actually follow you up personally. Why should you join International Institute for Healthcare Leadership and Quality Improvement? So if you see QI or QA, don't worry. The trend has been the movement in the knowledge world from quality assurance to quality improvement. So we are also aligning with the trend. So our name will be International Institute for Healthcare Leadership and quality improvement. So imagine an institute that is designed to bridge the gap in relevant education while enhancing your capacity as a professional to lead health system transformation. We want to build an institute that offers practical real-world training at an affordable cost, made accessible and then applicable to your everyday experience as an healthcare leader. That is our dream. That's the goal. And that's what we hope to either sell to you or wish that you absorb or embrace with us, such that we're able to drive relevant education that leads to transformation of our complex and dynamic healthcare environment in Africa. We have a very, very dear complex system. We have limited resources. We have wastefulness in the limited resources. We have a lot of fragmentation in our care system. We have a poor technical capacity, either at adoption level or in terms of even usage level or even the capacity to use. So we have a dear peculiar challenge that may not be comparable with the whole world. And hence, we want to design an institute that focuses on the African challenges and is able to target building leaders, building student professionals to become leaders who are ready to face these complex and dynamic challenges. We're also building a community of professionals with enhanced capability to engage in strategic redesigning of our health system. I don't want you to resume in a place and leave the place the same way. You should be able to strategically replan, redesign that system to ensure effective implementation of what is redesigned, and then to ensure strong evaluation of that implementation. Hence, the goal is to drive a standardized African health system. And then the third one is to build an institute that is affordable, project-based, outcome-driven, relevant to our own real-world scenarios in Africa. So these are the reasons why you should join and keep going along with us at the Institute. So I would love us to embrace this. These are points that are on the website already. So in case you want to go ahead to the website to read, I'm sure you can see the website now. I want to thank you so much for joining. I mentioned earlier, if you just joined, please put your name, where you're joining from. Would actually love to take attendance. And I know that there are people on the call that are taking attendance currently. So please, would like to have your full name. Thank you so much for joining. So I'm just going through the overview of the Institute currently. Before I go to today's class, so because we've been having questions. So, and the types of membership that are available is the student membership, the graduate membership, the professional membership, and the corporate and institutional membership. You would see all these on the website as well. And then this is the topic for today. Healthcare transformational leadership. This is the topic for today. So just permit me in few seconds. I want to see if I can get feedback from one or two people before I start today's class. I see Dr. Onidi Adeshola on the call.
Yeah, good evening, Dr. Joshua.
Thank you so much, sir. Thanks for joining. All right. So in one or few seconds, do you want to talk a little bit more, elaborate more about the point I've mentioned about the Institute? Dr. Nide Adeshola is one of the founders of the Institute. So maybe it would be good to just share your points, your opinions, and
Well, all right. Good day, everyone, from wherever we are joining. You have said a lot about it. What we eventually do is that anyone that is interested in extra information can let us know. We can send you a brochure that contain all the questions that you may want to ask us, that we have all the frequently asked questions. So apart from reading on the website, we can send you a brochure that will contain that, so that we can focus on today's lecture.
great. Thank you so much. All right. So please, if you have any other question for this topic, you can actually put it in the chat, so that at the end of the class, we would be able to address them. In the next 40 minutes, I would try to do some bit of justice to the concept of healthcare transformational leadership. And this is a passion for me. I've seen systems degenerate, and I've seen systems gotten revitalized at the same time. So I understand the pains of the people who get to suffer when a system goes down, and I've seen the joy in the faces of those who get to enjoy when a system gains life back. And most importantly is that the people that seem to be at the lower echelon, I mean the patients, are the ones who get to actually take the largest part of the brunt. It may affect maybe the employees, the workers in a way or the other. They also share a larger chunk of the pain. I'm not unaware of the pain we also go through, even in our own practices in Africa, where we have to deal with a lot of challenges with limited resources, poor leadership, and etc. So while we are conversant with that today, the goal is to help everyone who would either listen now or be listening later to be able to start thinking differently, seeing differently, hearing differently, doing differently. That is the goal. If you can start thinking differently, you will definitely start learning differently. If you can start thinking and learning differently, it will help you to start seeing differently. The reason why two people will enter into an hospital and one person will be pained at the issues they are seeing in the hospital and the other person will just be normal is because someone is thinking, learning, seeing, and maybe hearing differently. And the other person is just either not knowing or not able or not willing. And so those are the two differences. So if you're listening to this, the goal is such that the words you hear will start driving some concepts in you, some models in you, start putting some frameworks in your mind for you to interconnect the concept of transformation and to understand the concept of leadership from another dimension. That at anywhere where you find yourself, you will know you're dealing with a complex situation. Life itself, by its very nature, is a complex structure. And healthcare is a subset of life, and so it has to be a complex system. And because of that, there will never be any easy answer to any problem. So every time you enter into an issue and you feel bad and you're saying, why can't this happen? Just know that it's a complex scenario and it can't just happen. It can't just happen because there are so many stakeholders. It can't just happen because there are so many things that led to that in time. It can't just happen because there are so many causal factors that are either interrelated, interdependent, or that interacting with one another to get the quality of result you're getting per that time. Therefore, for you to lead transformation, for you to be a transformational person or a leader, you must then start getting comfortable with ambiguity, with navigating complex challenges. And if you now make up your mind to navigate complex challenges, what you're saying is that you love trouble. Trust me, any point you seek to create a change, at any point where you made the intention to transform a system, you are going to create some disruption. Such disruption, you would have some initial feedbacks. I love to call them feedbacks because they will come as pain points. They will come as flash points. People would actually demonstrate unbelievable amount of resistance. And if you are strong enough to survive those resistances, that is when you will start driving the concept of transformation. But today, I would love us to go through something a bit more practical. I'll start from the theoretical framework, then we'll dive into a case study, and then I'll talk more about some 12 points, and then we'll wrap it up, and then we can get some questions. So basically, transformational leadership style is a style where leaders seek to inspire and motivate their team. Please place emphasis on team. I've been learning a lot about if you want to transform great organizations of late. And one of the crucial things I've learned is that you cannot do any change work without a team. So if you are this kind of person that loves to work in a solo way, you don't like creating a community of people, then you probably might not be cut out for transforming your environment or transformation or even making significant changes. And that is not the kind of leaders we want to be, because our society, our system, our healthcare system needs major changes, needs fundamental, significant changes. That is the drive. That's the goal. So, because if you just make general changes within your culture, the rate at which the world is evolving, the rate of inflationary correction, the rate of value degeneration in our society is rapidly killing the amount of energy you will put in just small changes. Hence, the only change that can make significant difference is the change that is transforming. Let me give you an example to make it pictorial. Let's say we are both at this level and we want to get to this level. You can choose to say you want to make gradual changes, incremental changes, and you're going gradually like this. Someone can say, I will stay at this level for a while, build a good amount of team member, develop a lot of capacities, create system such that when I'm leaping, I am leaping significantly. And if I'm able to sustain the same thing, I can leap again to get to this point. But if you want to grow gradually, the problem with this kind of growth, this is general change. This is what we call transformation. Transformation is you're actually changing in form. You're changing in form your processes, you're changing in form your culture. These are two, and you're changing in form the quality of mind of the people. But in change, the people doesn't change. What changes is just the external circumstance. In transformation, you change the people, you change their quality of thinking, seeing, doing things. That is the goal. The people themselves changes the culture. But when they change the culture, the interaction of these people and the culture changes the processes, and then they're able to generate big and transformational outcomes. This takes a longer time for you to get results. It takes a bit longer time, more investment of intelligence, integrity, energy, intentionality, but it is always worthwhile in the long run. We can bring a new CMD. It can do so many adjustments and make changes. In a matter of 3 to 6 months, everything nosedive back to what it was. Simply because the quality of mind of the people hasn't changed, the culture hasn't changed, the processes hasn't changed. Hence, you cannot expect any transformational outcome. So if you are looking to be a transformational leader, your goal will be to be someone who is inspirationally motivated. You must yourself be internally inspired about the dream or the drive for transforming your healthcare system. You must be someone who has an impeccable character. You yourself must lead by example. You must show up with energy. You must show up with integrity. Your character, your word must be your bond. You must be a transparent person. You must show up with high level of character, ethical character, right? Ethical dimensions of leadership, where you would come up with some impeccable nature that people will be able to trust your word as your bond. Then you must show up with some level of compassion that demonstrates individualized consideration. Every member of your team must have a direct emotional connection with you, or at least with someone on your team. There must be a chain. Is it that if you're the leader, every layer in your team, if you have multiple layers like this, they must also have those kind of connection with other layers. That is the only way you can generate great results. Or you yourself have some direct relationship with some people like this, and that's the way the chain keeps going down. You must be able to build a systemic structure this way where everybody believes in the word. At any point where the words of the leader does not carry power again, and it does not seem to be showing compassion, then his word starts losing weight. And then ultimately, as a transformational leader, you must be intellectually stimulating. You must know your onions well So I call this the dimension of competence. You must demonstrate competence in leadership. You must demonstrate competence in technical know-how on how to get things done. Fundamentally, if I just want to break them down into points, as a transformational leader, your goal should be to be visionary. One of the classical defining factors or features of someone who is transformational is that they have the capacity to see, and they see what others don't see. And so you must start internalizing the capacity to be able to see beyond the immediate. If you want to do a project and the first thing that weakens your mind is either the cost or the discipline or the energy required, you probably are not ready to transform yet. When you become transformative in nature, which is the goal of this class, which I hope you would be able to make up your mind passionately to become, then you will push to be a visionary person. How do you become that? When you enter into an environment, you must put a lot of pressure on yourself to become very observant. You must learn to try to see the challenges, to identify the issues, the problems in that environment. If you don't immediately ask questions, keep asking questions until you're able to reveal the challenges. From the problem, you will create a vision. Vision always comes from problems. And that is why you must love problem. If you want to be a leader and you want to run away from problem, then what you're saying is, I want to be a follower. And remember, prayer isn't just what you go and kneel down to ask for. Prayer is actually what you do too, because action speaks louder than voice. So if your action is showing every day that you dodge problems at work, you're always the first to disappear when it's 4 p.m. on the dot, then you're not showing yourself to be transformative in nature, neither are you on the path to visionary kind of leadership. You must embrace the capacity to see problems and to see it with a positive mindset, to see it in a way where you can reframe it, where you can then define what the true north should be. So true north is talking about when you have a compass and you have your scale moving away like this. If you're a visionary person, you'll be able to define the gap between what they call the current north and what the true north should be. This gap is the problem, and your vision is to bring this scale to this end. But don't forget, you need a team. Every great agenda, either you want to transform your lab, you want to transform your physiotherapy unit, it's your ward, emergency ward for nurses, for just imagine any field, even in education, like teachers in healthcare. If you really want to transform anything, you need team. You need to build coalition of people who will believe in the idea and in the ideal for transforming that environment. You need to also be engaging. You need to engage the power factors. When we talk about the power factors, we always talk about two things. You need to engage at political level, and you need to engage at economic level. If you would create any major change in your environment, you need to engage the leadership in terms of those who have the authority. And then you need to engage the director of finance, those who have the capacity for economic advantages. And so that brings us to, how do you do that? You need some sound discipline. You need to really define what you want. You need a lot of knowledge, learning, to be able to present your case in a succinct way that would also demonstrate that you have factored the interest of these two leaders into what you're doing. You need to put some monitoring and evaluation systems in place and ensure that you are someone who always creates platform for so many people to thrive. If you do this and you position properly, over time, you will see that supernatural advantage that will come your way, and you'll be able to generate big and transformational results. If we want to refactor anything, and I want you to see with the eye of a transformational leader, my goal will always be to help you to find a way to change the way you learn. You must start learning with the mindset of not only changing things in your immediate environment, but changing things at a significant and at a massive rate. And how you think, and then how you can work with people to build a new system. You can only do this at personal level, at social level, and at structural level. So I said it earlier that for a transformational leader, you must learn to identify problems and then identify them with their system-based root causes. You must have the capacity to develop strategic plan and interventional designs. You must then be able to foster integration by continuous engagement and education. adopt implementation science. Everything I've said is just a list of the point. If you look at my screen, in transformational leadership, individualized consideration involves maybe treating all employees the same. That's no. Providing personalized support and mentoring, maybe in a way, yes. Ignoring employee needs, that's outrightly out of the point. Focusing only on top performers, that's a no. So B is your option, providing personalized support and mentoring. One way transformational leaders support their team is by, from the little thing I've said, I'd like some people to put some options in the chat. One way transformational leaders support their team is by A, providing clear guidelines with no flexibility. B, encouraging professional development and growth. C, limiting opportunities for advancement. D, maintaining a hierarchical distance. I'm looking at the chart right away. If you have your answers ready, please just drop it in. Drop it in. That's the second question on your screen. On one way transformational leaders support their team is by, okay, so I have some options popping in. Thank you so much, everyone dropping it. That's great. Okay, encouraging professional development and growth. So that's classic. Thank you so much for participating in that. I have some 6 other questions I would love us to quickly run through. So please, this question says transformational leadership in healthcare primarily focuses on. I love answers in the chat now, please. This would drive us to participate. Question 1 says transformational leadership in healthcare primarily focuses on A, maintaining the status quo. B, implementing incremental changes. C, creating significant positive changes. D, reducing cost. Please, let's have your answers. For question 1, transformational leadership in healthcare primarily focuses on, okay, I have some options coming in. Thank you so much, Dr. Lucky. Who else is bringing on? Transformational leadership in healthcare primarily focuses on A, maintaining status quo. Yeah, great, coming in. Thank you for keeping them coming. Maintaining status quo. B, implementing incremental changes. C, creating significant positive changes. And D, I so much love this this cohort or this class. One of the trainings I took, there were a lot of confusion between options B and C, but I love everyone here is speaking C. The difference is that I had explained the difference between change and then transformation. Transformation is talking about significant positive changes. Thank you so much for grabbing that. Let's move over to question 2 quickly. Question 2 says transformational leadership contrasts with transactional leadership by A, emphasizing rewards and punishment. B, focusing on short-term goals. C, inspiring and motivating followers towards long-term vision. D, maintaining traditional methods. Let's let the answers pop in quickly. Question 2. Okay, great. Yeah, answers are started coming in. Thank you for participating. So if you can inspire and motivate followers towards long-term vision, then you're already thinking transformatively. And this is not limited to people in our healthcare society alone. In our workplace, maybe in our family, any other place where we interact with our world, we should be able. Thank you so much. Oh, question 3 is already coming in. That's great. Okay, so for question 2, inspiring and motivating followers towards long-term vision is the answer. Number 3 says, which of the following is not a characteristic of transformational leadership? Which of the following is not, but someone already dropped the answer to question 3. But let's just check it. Which of the following is not a characteristic of transformational leadership? A, inspirational motivation is a classic characteristic of transformational leadership. B, idealized influence is a classic characteristic of transformational leadership. C now says passive management by exception. That doesn't sound like transformation. So C, it would be the answer to that. And then D says intellectual stimulation, which is one of the points. Number 4, let's jump to question 4. Transformational leadership encourages A, status quo maintenance. B, continuous improvement and innovation. C, sole reliance on traditional method. D, minimal employee involvement. Okay, so the answers are coming in now. Thank you so much. Transformational leadership encourages. That's question 4 now. Status quo maintenance, continuous improvement and motivation, sole reliance on traditional method, minimal employee involvement. Okay, so I can see some answers popping in. Let's keep them coming. Thank you so much. Okay, so we all agree that continuous improvement and innovation is what transformational leadership would encourage. Number five, transformational. Thank you. Number five, transformational leaders in healthcare are often described as A, task-oriented, B, transactional, C, visionary, D, authoritative. Transformational leaders in healthcare are often described as A, task-oriented people, B, transactional, C, visionary, D, authoritative. Okay, 5C, visionary. Once you see visionary, it's a classic definition of someone who loves transformation. So my goal, my thinking, my prayers, my wishes, every of my being wants to passionately communicate this to you. Everywhere where you are, do you have a vision for its movement? And not just changes within the external environment, but the changes that first start with the people that are with you, their capacity being lifted, being elevated to create that team that would help you to now transform the system. You cannot, transformation is not a one-man scenario kind of relationship. It's a scenario where someone catches the dream first, but that person drives others to catch the dream, forms a team of dream catchers who will now start driving transformation of that system. And don't forget, it's not just changes in the external environment. It starts with changes in the inner mind of everyone, getting everyone convinced about the need for transformation, and then pushing ahead to lead that transformative agenda. Number 6, effective transformational leaders in healthcare often, 1, discourage team collaboration, 2, promote a culture of trust and openness, 3, C, focuses only on their personal career goals, D, rely heavily on external consultants. Okay, number 6, I'm seeing some answers coming in. Let's keep them going. Yeah, great. Let's keep them going. Once you see people who only focus on their personal career growth, they are not ready to help others. You're not inspiring people behind you. You're probably not a transformational leader, and you're probably part of the African problem, if I can put it that way. So if you have light, the essence of your light is to shed it as a light onto the path of others so that they can, in your light, also find their light. And that light will give life unto them for them to now become transformational. So because of that, transformational leaders are people who have some culture of trust and openness. They are open to helping people, supporting them. You're pained when you see a younger colleague not doing well, not focused, because you know that it would also be part of the problem of the system. Is only a matter of time. The failure of every leader you see up there is part of the failure of the community that raised them. So if you in your community decides to look away and say, I don't want problem, let me just look away, you're also contributing, because in a matter of 5, 10, 15 years, that same guy you looked away from becomes the CMD of your hospital. And because you have failed to hold his feet to the fire when he was younger, he will go and replicate the deficit in his character up there. And hence, it would bring down the system ultimately. So whatever we find in our system is actually created to defend that thing. Thank you so much. Now to our case study. And this is where we'll be wrapping up. I know I have about 20 minutes, and so I would love to exhaust it on this case study. And please, I would love to, I don't know if someone wants to unmute and read for us. If we will get someone to just read, and then I'll just put a discussion, just to be sure we're all getting along. Can you all see my screen? Who wants to volunteer to read, please? Let's make this quickly. Let's make it happen quickly, please. Thank you so much. Someone jumping in. Thank you. Please, you can start.
Okay, are you people getting me?
Yeah, I can hear you now.
Okay. Case study 1, transforming your health system, healthcare setting. Dr. Mina is a healthcare leader in a state teaching hospital in Nigeria. She has just been transferred to a head major unit of the hospital alongside a healthcare administrator. Faced with significant challenges such as limited resources, inadequate infrastructure, and a shortage of healthcare professionals, work culture, value, there is largely medical and lackadaisical. Many of the staff arrive late to work and some even skip days entirely. She learned from those who have been there for years that this attitude has been deeply ingrained over time. In our first week, she asked the HR department to issue warnings to some of the staff, but this approach seemed to backfire, leading to a sense of solidarity among the staff and a rise in a passive resistance. Can you raise it up for me from the screen?
No, that's
Sorry.
it. That's it from
That's
that
it.
side.
Okay.
Yeah,
Okay.
you can jump to the other side. She wants to
Okay.
embark on a mission. You can
We
jump.
want to embark on a mission to transform the healthcare system. Our plans are introducing telemedicine service to connect with the specialists, organizing training programs, initiate partnership with the government agents, NGOs to improve medical supplies. How can she lead this team to achieve improved healthcare delivery, patient outcomes in the communities, and transformation of their healthcare setting?
Thank you so much for reading that out for us. Appreciate you. Critical things, it's a largely mediocre and lackadaisical setting, limited resources, inadequate infrastructure, shortage of healthcare professionals. People have deeply ingrained poor attitude to work. They skip work, they come late. When you issue warnings, it backfires because they call on politicians, call on different things. How many of us can resonate with this scenario? I want some response in the chat. How many of us can resonate with this scenario? Does this happen in your environment, in your workplace? I need responses in the chat, please. How many of us can resonate with this scenario that you have this all occurring around you? You have a work environment that is highly challenged, and your setting, there's a lot of silos among teams who are ready to self-sabotage. Thank you so much, Dr. Mohammed Ashi. Thanks for identifying with that. So we have a lot of challenges like this every day. Oh yes, okay, thank you so much. Yeah. So please, I love feedbacks. Let's if you find if there are points that you think I even missing that I didn't mention, there are some common cases. Thank you, Doctor. I'm so glad to see that. So it's not a Nigerian anomaly, right? It's and I don't want to say it's Pan-African. I see some resonance of it in Asia as well. I see some resonance of it even in America. You'll be surprised. And when I say this, people say, no, 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 no. I've worked in a system where they have inadequate resources here too. Of course, maybe the attitude is a little bit more improved, but here and there, you could see some people with some poor attitude as well. That's been deeply ingrained over time. So I just want you to know it's a human scenario issue, not an African peculiar problem issue. But that being said, the impact in Africa is huge because we already have some background system that amplifies or augments the negative impact of all this. I don't know, do we have one person, maybe in like 2-3 minutes, who just wants to say something about how do you think she can lead this kind of team to achieve improved healthcare delivery, please? I just want to give 2-3 minutes to someone who wants to go to just talk to us about how you think Dr. Amina can go about it. And then in the last 10 minutes, I'll just wrap up with the point I have, and then we'll have a great session. Who wants to go, please? Anybody, you can unmute. Just tell us from your experience, how do you think Dr. Amina can turn things around in this setting? All right, Dr. Mohammed, please go ahead. Dr. Mohammed, are you able to unmute? Okay, while we're waiting for Dr. Mohammed, if any other person wants to go, please feel free to unmute and let's have you. 2 more minutes, please. In 2 minutes, just give us some succinct points. What do you think? How do you perceive this problem? And then how do you think, from the little sharing about transformational leadership, how do you think you can actually lead this kind of team to achieve some improved healthcare delivery, patient outcome, and turn things around? Do we have Mrs. Bumilola Oyeleye? Do you want to unmute and speak? Who wants to go? I still have 90 seconds. 90 seconds. Okay, please go
hello
ahead.
everyone.
Thank you so
Hello
much.
everyone.
Yeah.
So what I think she can do is, first of all, she could do something to bring the staff out of their shell. Whatever that is going to be maybe like a friendly, like a friendly meeting, maybe like a get together or just something, or a simple gathering to bring all of the staff out of their shell. First of all, get to know them, get to interact with them, get to know a little bit about their challenges. Maybe some of them are even going through challenges and stuff. So when she interacts with them on this level and she creates a rapport and a sort of camaraderie, then she can now begin to work on them gradually. When they see that she's this friendly person who is interested in them and not just an authoritative boss, maybe they might now begin to be open to changes. So she needs that, to level the ground first. And then she can now start to, inspire, encourage, and all of that and all of that. I think that's my little idea.
Excellent. Thank you so much. You hit the nail all right on there. Dr. Mohammed, please go ahead now.
Thank you. I would like to thank the organizers of this valuable Zoom meeting. So I think in Africa we have a common problem regarding to when we are talking about healthcare systems.
Correct.
So this kind of meeting will lead to achieve a milestone more than expected. So I would like to say we need to have more discussion about this Zoom meetings. So we need to achieve more, and we need also to have more discussions, more training about healthcare leadership. We know the cases in Africa dying from every disease, or they are dying from minor diseases, like when we are saying about infectious disease like that.
Correct.
And also they are having some, if we have talking about the non-communicable disease, most African countries, they go to other countries like Asia, India, something like that. They go to the seeking for the quality healthcare service.
Correct.
So we need to we need to achieve more. We need to discuss more. We need to address more. So that's what I'm trying to say. And thank you for this meeting. And I would like to interact my colleagues from this meeting. Excellent. And I would like forward to hearing from you soon. And also we need to, I think you sent the link of the registration. So we will, and also I will register the link. So excellent. Thank you for everything. And I would like to continue this, even if we can schedule this meeting around every month, twice or 3 times or something like that, if we agreed about that. Thank you again.
Thank you, Dr. Mohammed Ashi. It's nice hearing your voice, and thank you for those inspirational words. It's quite inspiring, let me put it that way. Okay, so let's go ahead. We have the problem, we have what we want to embark on. I would just want to say something. If you're thinking about transformation, think about it in these 6 ways. Any form of system transformation you want to do, you need a transformational leadership model to start with. You need leaders who would have a model. In any other transformation you want to do, in any transformation you want to lead, you need a thinking and a design. You need a plan. And that's why, if you notice the NGOs that come towards Africa or like developed nations, they have what we call strategic plans, strategic designs. In the United States, they have the rules for capital, for wealth formulation and capital creation. Every serious-minded organization or nation have what we call that strategic planning document or design. Once you don't have it, what you're telling the world is you're not serious. And that's why so many leaders in Africa, political as they are, you see them get into position, you know they don't have a plan because you can't see any strategic thinking or design. Then the next thing is, how do you improve the system performance? Because at every point you must measure what the system can do, and how do you move it from that level to a higher level. So if you are in a problem, the first thing is you want to know what the capacity of your system is at that level. And then if you're able to improve it, that's when the problem will reduce. Then the next thing is value creation by your system. Anytime you mention the concept of value, the next thing that comes to the mind of any brand strategist is that you're driving towards uniqueness. The day I make up my mind to be an orthopedic surgeon, I have narrowed down a value for myself, and I'm already creating a brand for myself in orthopedic surgery. So that's how this concept of value and branding works. And then ultimately, the impact will now be the ultimate measure. Now, if you're thinking across the 6 dimensions, it will help you to answer the question with Dr. Amina. The Dr. Amina's question, just like Ms. Bumi said, the first thing is you must build trust and relationship with the team. If you miss it at that point, you're probably not going to be able to transform anything in that system. So she said, maybe invite them for party or something, do a get together, engagement. So what we call it, it's a form of engagement kind of scenario where you now have to interact. Because they don't show up, you may have to go the extra mile of going to meet the people. So you have to build trust and relationship, and you have to build it with care, because if you're not empathetic about the whole scenario, if you just jump to conclusion, then there's going to be issue. And then you must bring the idea of transparency. They must see that you don't have any hidden agenda for why you're trying to pull them closer. Once they spot any form of manipulation in the way you think or do things, then you're going to lose their trust again. One basic advantage you have is that you are just coming. So you can leverage the fact that they don't know you before, and then you're able to build trust. The number 2 is that you must understand the root causes, a systemic root causes for all the problems we have. Yeah, we can make the presentation available, and the video would actually be available on YouTube, and then, so don't worry, Dr. Mohammed. Then the third thing is, then once you now understand the root causes, you've gotten the people to your side. These are not things that happen spontaneously. Let me be very clear. And that's why I said transformation always takes time. If I want to lead change in an environment, once I get there, I'll just look for what the people need. If they need money, I'll get money for them. You can manipulate people with money, with gift, with stuff, and you start changing things around them, but it will not last, because the source of fund will soon dry up and it will not be manageable. But in the short run, you can get people to trust you, to embrace you, and you too would be ready to lead by example. Show up early. Show up to work when it's due. So when you establish a clear vision and expectation, and then you yourself are leading by example, you will start seeing drift. John P. Cotter said that if you want to lead any significant change, in the first phase, you may only have 1 or 2 people join you. After a while, they become 3 to 5. After a while, you get them to become 10. After a while, you get to 10 to 15. By the time you're getting to 15 to 25% of the organization joining you on a transformative journey, that journey, it's very hard for it to fail, except if you have not built enough momentum. If you have built enough momentum and you're able to drive to the point you are now having 15 to 25% of the organization believing in the ideal and following you, but that rests on your capacity as a leader. That rests on your capacity to foster positive team spirit, to also be able to empower and motivate them. When they say empower, you don't only train people in terms of skill, you train them in terms of knowledge, but most importantly, you also give them tools to make the work happen. No matter how knowledgeable I am, if I don't have this board that I'm using to teach you, it will be much more difficult for me to teach. So you need tools. You need to get tools. You need to get softwares for people. You need to get so many platforms. Even simple tools like Excel, Word, PowerPoint can also make a whole lot of difference. Don't get me wrong. You can do paper-based tools or electronic tools, but we all know digital tools are way better. But you need tools if you really want to empower people. But you see, the most important part of the empowerment is not only limited to this skill, knowledge, and tools. The most important part is the leadership part we're having today. I tell people this, and please, I hope you would take this away today. You see, in life, what Dr. Mohammed is describing the other time is what we call the sharp end of the problem. When people start dying, you have kids dying of malaria maybe every 2 minutes. That's the sharp end of the problem. What we always don't focus on is the blunt end of the problem, where the issues are. This is the systemic place where troubles are. This is where the mindset is wrong. If we can get the mindset right, is the systemic mindset. If we can get the systemic mindset right here, gradually the sharp end problem you foresee will start declining. So in every problem you have, either personal, communal, church-based, mosque-based, any form of problem you have, there's a mindset that is driving that problem. Unless you go and address that mindset, even if you change the skill of the people, the knowledge of the people, or the tools the people are using, that poor leadership mindset will kill this skill, kill the knowledge, and kill the tools. And that is why the place of empowerment in terms of leadership training is so crucial. I am 1 minute away from time, and I want to keep to time. So I will only read through the last set of points. One of my blog posts these days would come on this healthcare transformational leadership, and I'll take time to write so much about it. So please, you would be reading it on the website. The next one is encourage participation and ownership, implement gradual changes, and then once you get momentum with the gradual changes, seek for a transformational goal. The reason is that when you do gradual changes, you are only changing external environment. When you seek for transformational growth, you are changing the people themselves. It is only when you change the people that you will be able to get sustainable growth. And then the next thing is always address resistance, address negative behavior, and address any form of underperformance constructively. Anytime you find resistance, negative behavior, and underperformance in your environment, do not keep quiet. You either call the person into a closet and address it, or you address it openly based on the terms and conditions of those environments. If he's a more senior person, address it privately. If he's a less younger person who can be mentored properly, address it openly. If he's a younger person who is troublesome, who is going to create scenario, address it privately and then come and address it publicly. But always make sure you put some public balance to addressing things, because it drives the message across the board. And that's the advantage. Then monitoring and evaluation and communication of progress, implementing recognition, reward, and reinforcement of improvement. And then you will always need external support and collaboration. There's nothing you will be able to do alone internally within your system. You would always seek collaboration from NGOs, agencies, government, etc. I want to thank you so much for taking time to listen. This is about a minute after. I'm open to questions. Anything you have, please, at this point. The recorded session will be on our YouTube channel. It will be posted on the WhatsApp group. Once it's ready, it takes a while for Zoom to download it. And so once it's ready to be uploaded, and then the link will be shared. Thank you. Questions, please. Maybe we'll only be able to take one question, and then would call it a day.
Thank you very much, Dr. Joshua, for your wonderful presentation. While people are getting their questions ready, someone asked if the presentation will be shared. You'll be able to get the presentation slide if you want it. It can be forwarded to your email. And just like Dr. Joshua said, the recorded version will be on the YouTube. Another person asked question on the chat to find out if the fellowship is going to be free. There are free courses, but the fellowship program is a year program that will allow people to get a fellowship certificate. We are also working with some university that will also enable people to get a postgraduate diploma, a higher diploma in healthcare leadership. So that will not be free. Now, another person asks if this program is going to be 100% online. No, the program will be 75 to 90% online. There will always be once a year physical meeting that will be moved across African country. During that period, there will be training session, there will be knowledge sharing, there will be presentations, and people will be inducted. The next fellowship program that will be physical will be holding the last weekend in November in Kigali, Rwanda. Registration will soon be on. So people that are interested in being there physically should start getting ready to be there now. We will be providing more direct information in our email. That's why we're encouraging everyone to register on the website so that you'll be receiving direct information from us. And you can always check. Please, if you are yet to join the WhatsApp group, I already dropped the link on the chat so that we can just click once and for all and join the WhatsApp group, and you'll be able to chat directly the admin for questions so that you won't need to wait till when we're having webinar like this. Thank you very much for your time.
All right. Thank you so much, Dr. Adeshola Onide. Any question, please? All right. In the absence of questions, it's been an honor to serve you today. Thank you so much for creating time to listen to me. Okay, Dr. Dennis Anthony, please go ahead. Please go ahead, sir. Yeah, are you having technical issues? I can see your hand up, except it's a mistake. Okay, I'm not getting you, so I'll assume that's a mistake, and then we're progressing to close the meeting. Thank you so much, everyone, for joining. Okay, I'm seeing some chats. Let me read out the chat. Okay, there's no information in the chat. So thank you for joining. Hope to see you in 2 weeks' time for another session. I hope you would register via the Zoom and then get to join, and then invite friends to also join. Have a great evening. Bye.